most people don't need glasses until they hit their 40s. Now, most people don't know that everybody needs glasses starting sometime in their 40s. There's very, very few exceptions to that, and those exceptions are like the kind of exceptions that prove the rule. Like maybe they have one nearsighted eye and one farsighted eye, and so then they don't need reading glasses. But every person with normal vision will need glasses for reading by 48 years old.
Welcome to the Haque's Health Hacks Podcast, your trusted source for wellness, fitness, and healthy lifestyle insights. We believe in empowering you with knowledge to take control of your health. Join us as we explore the latest in self-care, share expert advice, and guide you on your journey to optimal well-being. Let's embark on this path to a healthier you together.
Hello and welcome to Haque's Health Hacks Podcast. I am your host, Dr. Anita Haque, and I am so honored to have an amazing guest on this show today who's not only a friend for many, many years, but he's also very well regarded in our town as our top optometrist from Murrieta Optometry here in Livermore. So Dr. Scott Kamena, welcome. Thank you so much for coming on. It's such a pleasure.
Thanks for inviting me.
Yeah, we've been probably working with each other. I've been working
2007.
on you. Oh, was it? You know the date. I actually thought it was less than that, like 10
Maybe
years.
2008, but yeah,
Wow.
I'm pretty sure 2007.
So we both watched each other evolve, health journey, our practices, in so many ways. And I was just wondering,
90 pounds.
You did lose a lot of weight
Yeah.
with training with Don Parker, my husband, at the gym.
Nutrition.
Nutrition and all the things. And I've had the honor of, working on your body because you work your body really hard too in postural positions. So if you don't mind to give us a minute, share a little bit about your journey, as an optometrist, like what inspired you even to become an optometrist from the start here?
I mean, the real answer is my dad is an optometrist. I mean, he's retired, but he's still got his license. And we grew up here in town, and my dad always had the opportunity to be involved in our lives, in scouts and everything that my brother and I did, all our activities in school, and he was involved in city politics, back in the 80s, and so it gave him the opportunity to do something that allowed him to be social at work. I love people, he loves people, so it's a job that people ask me, do you like your job? And I will say it beats working, because I get to spend time with people, talk to them, and do something that helps them, and it doesn't hurt. It's not like going to the dentist. It doesn't hurt. So that's how I got inspired.
You're so right. I don't know if I've ever shared this with you, Doc, but I considered going into optometry.
No.
Yeah.
You never told me.
No, I haven't told you this because the one thing that deterred me from, going down that path was that there's quite a bit of physics involved.
There is.
And I did not enjoy physics. So I first thought about becoming a dentist, and I decided I don't want to do that. And I thought optometry was my next, choice. And then when I learned that it was like a lot of physics, that's kind of what led me down chiropractic.
There's a lot of forces in chiropractic, that's for sure.
Mm-hmm. But yeah,
I mean, the thing is, what you have to do, the classes you have to take are not really representative of like what you have to do on a daily basis. But there's a hurdle you have to jump. But a lot of people, if there's any parents listening or kids listening, it's like, if they don't like chemistry or they don't like physics, they just have to get through that. And when you're actually doing school, you're not really thinking about physics or chemistry that much.
Oh, shucks. If I'd only known. No, I'm kidding.
Yeah, well,
I'm
you are a wizard at what you do. And I think that it's a good thing you don't like physics.
Yeah, see, everything works out the way it's supposed to.
Exactly.
So I have a question for you. I think, for our listeners, I just want to show that you're generally a more well-rounded, holistic type of practitioner, which is why I think you and I have always resonated. I mean, you not only, like I mentioned a couple minutes ago, that you've, had chiropractic care, through my hands, also with the training, nutrition.
You
So
do it
like,
with your feet too.
yeah,
I'm
we both.
just kidding. Yeah.
So, like, why do you think like eye health is so overlooked? Because I think it is. When people think about their overall health and wellness, like they think about their weight, but how do you feel like the eyes are really connected to the rest of the body?
So, I guess the first part of the question, why is it overlooked? Um, I mean, most people don't need glasses until they hit their 40s. Now, most people don't know that everybody needs glasses starting sometime in their 40s. There's very, very few exceptions to that, and those exceptions are like the kind of exceptions that prove the rule. Like maybe they have one nearsighted eye and one farsighted eye, and so then they don't need reading glasses. But every person with normal vision will need glasses for reading by 48 years old. But usually, the average age is actually 43. Most people don't know that. And so, and most people think that if they see well, that their eyes are fine. And most of the time, that's true. But conditions like glaucoma, which is where the eye pressure, and I have a model, I guess maybe I should grab it or something.
No, no, it's all good. It's interesting. While he's grabbing that model, Dr. Kamena, I too came to visit you around 44
Yeah,
and
that's pretty
you
common.
about my eyes, and you told me the same thing, and I was shocked when you said you're definitely going to need glasses sometimes, but not today. And I
Yeah,
was like,
not, yeah,
mhm.
yeah. And then people, think I like, curse them or something, but it
Yeah,
happens. And so the reason is there's a lens inside our eye. So this is a model of an eye. I guess, it came from a plastic elephant. And there's a lens here, and it is surrounded by muscles, and the muscles squeeze it to change the shape. And so if you have normal eyes and you just relax this muscle, you see good far away. And then when you want to see up close, then you squeeze the muscle. I mean, squeeze the lens with the muscle, and then you focus up close. But the problem is the lens gets hard over time, and somewhere in your 40s, it gets hard enough that you can't do the focusing anymore. And so that's what triggers a whole bunch of people to get their first eye exam. A lot of people also get their first eye exam when they're kids because mom wants to make sure they can see before they go to kindergarten. And one of the things that I just cannot understand is you can't go to school in California without getting a dental exam. So you have to have your dentist sign off it's okay for you to go to school. You do not need to get your eyes checked. Now, I mean, it certainly would be difficult to learn if you're in pain, if you have tooth pain, but you don't use your teeth to learn, and you need your eyes to learn.
so true.
And a lot of kids function just fine, um, but actually have an issue, whether it's a focusing issue or they could be farsighted, which means they see. What it really means is they have to use this muscle to see clear far, and they have to use it a lot more to see up close. So they're focusing all the time, which often gets mistaken for attention deficit disorder. There was
Interesting.
a study that 25% of kids who were diagnosed with ADD actually had farsightedness and that had not been diagnosed.
Wow.
So um, kids really should, and they could have astigmatism. And astigmatism is where this part of the eye, the cornea, is bent, and they can still see okay, but it but things aren't as clear, and it takes more effort to focus, and reading is more difficult, and they don't know because if you were born with something, you
Yeah.
don't have any reference point, and so
They
you
have
don't.
no idea that they have
Yeah,
vision issues if that's all they know. So you're absolutely
but
right. Why isn't an eye exam
it's
mandatory?
not required, but it's definitely recommended. If you know, people
Yeah.
ask me when should you get your first eye exam. The official answer is at 6 months, 2 years, 4 years. and then every other year. That's the official American Academy of Optometry,
So it starts at
American
6
Academy
months.
of Pediatrics. But do people really do that? Do kids, do I see 6-month-old kids, 1-year-old, 2-year-old kids? I do. But do parents bring them in if they don't suspect there's something wrong? Not very commonly.
Yeah,
But you
probably.
absolutely should get your eyes checked before you start kindergarten. I mean,
Um,
because you just don't know, and you have a baseline. But to answer to your original question about why people overlook it is they assume that if they see fine, that their eyes are fine. But glaucoma, which is not very common in people under 50 at all, but still it's possible to get, is where the pressure in the eye starts to elevate to the point that it damages the optic nerve, which is a connection to your brain.
Right.
And the body is an amazing thing, and it will cause the peripheral vision to go first in a way that you will not notice at all.
Yeah, it's like
And
slow,
pressure
right?
is very, very slow. If you wait until you notice that there's something wrong with your vision, it's too late to restore what you've lost. And the issue is that the normal range for pressure is between 10 and 21 millimeters of mercury, which is the same scale they use for blood pressure. So much, much lower than blood pressure. But you don't feel pain until somewhere between 30 and 35. So there are people running around, many thousands, if not some millions of them, who have pressure around 28, and it's eroding their nerve, and they don't feel anything. So the short answer to your question, why people overlook it, is they just assume if they see good, then their eyes are good.
So, one important thing that I know I've shared with you, but even for our listeners, you're so right about glaucoma because my mom was diagnosed with glaucoma in her 20s. And so for me, eye health was important at a young age because it was, familial or hereditary. And and for that reason, I had gotten my eyes checked pretty regularly. Sorry, hearing a little bell here. Yeah, so I used to get my eyes checked really regularly because my mom having glaucoma, she would insist that my sisters and I, get checked every year. So luckily,
Yeah, for sure.
and you've checked too
Did anybody else get
recently.
it? No, you
No,
don't
not
have it for sure.
yeah,
Any
thank God.
sisters with it?
No,
Yeah,
not that we know of. Yeah, and they've all
good.
so it's maybe skipped a generation. Hopefully not, but for anybody else's sake. But you're absolutely right. She would have not known unless she had that eye exam because she didn't have any symptoms.
Yeah.
So yeah, it's important. So one of the things that I hear about all the time, and we talk about nutrition in my practice, I know in your practice and in our conversations because it's so vital. How do you feel like nutrition impacts eye health? Like, are there like specific foods that you might recommend? Like, I know
Well,
people eat carrots, right? Like
everybody
that's
talks about carrots, right?
yes, exactly.
With regard to, so carrots have vitamin A, and the retina needs vitamin A to function. But the reality is, almost nobody has vitamin A deficiency in the United States. Um, Carrots, beta carotene turns to retinol, and the word carotene comes from carrot. Um, but that's where vitamin A is made. But if you have a vitamin A deficiency, you're just going to go blind, and that's it. I mean, and you go blind quickly, and it's not going to get recovered. And so, but eating more carrots doesn't actually help. You get enough vitamin A. More vitamin A doesn't help. You don't use the extra vitamin A. I'm not telling people, not to eat carrots. I'm just saying that the American diet has plenty of vitamin A,
Got it.
and eating extra doesn't really do anything different. Now, in third world countries, it's a big deal, and India has the highest rate of vitamin A deficiency and kids going blind. But in reality, carrots don't make you see better. They just don't. It's a something you need for minimum functionality, and people do get it from other foods that they eat. Um, and they may even supplement it in milk. I'm not sure. I know vitamin D supplemented in milk. But again, I mean, I've never seen vitamin A deficiency in real life, and I don't expect to ever see it. Really, when it comes to eye health, the most important things are antioxidants because they help to prevent cataracts. Cataracts are what happens when this lens inside our eye gets to be not clear anymore. So it'll turn brown or yellow. It'll have white stripes in it. It's like looking through dirty lenses, except you can't clean them off. The only way to fix it with current technology is surgery. Now they are working on drugs, and several years ago I saw an interesting study that had an eye drop that cured dogs of cataracts, but I haven't seen any follow up to that. Right now, all we have is surgery. So antioxidants do help slow down the
That could be like berries and like, just green leafy vegetables, things like
right,
that are high
right,
in antioxidants. So basically plants,
yeah, right,
right? Yeah.
right.
I mean, let's just make it easy for our listeners. If you eat more plants, you're going to have a healthier body. You're going to have a higher level of antioxidants. So
And then the
that,
other thing that people may have heard something about recently is lutein. So,
mhm.
and then lutein and zeaxanthin. And zeaxanthin is one that very few people have heard of, but you do see lutein sometimes in commercials for products like, Preservision, which is a vitamin for the eyes. Um, and if in this model, there's a little dark spot in the retina, which is supposed to represent the macula. And the macula is the part of our eye that we aim with, the part with the good vision. And there's a condition called macular degeneration, which is the most common cause of blindness in the United States. Now, it primarily happens to older people, primarily people over 70, but it turns out that blue light and certain frequencies of blue light, not all blue light, but sort of a purplish blue light, is what is the main frequency that causes damage to the macula. A lot of people think ultraviolet light
Wow.
is harmful to the retina. And the fact is, no ultraviolet light gets back to the retina. All of the ultraviolet light that enters the eye gets absorbed by the cornea and the lens. None of it gets back here. So we tell people to wear sunglasses primarily to prevent damage to the exterior of the eye through ultraviolet light and to delay the onset of cataracts, because the
Hmm.
more sun exposure you have, the earlier you'll get cataracts. But
Interesting.
the macula has this tint in it, and that tint comes from lutein and zeaxanthin. And so you'll see advertisements in vitamins for lutein and zeaxanthin, but in terms of like eating it, and I was apparently orange and yellow peppers are some of the best sources of zeaxanthin.
Really? Okay.
Um, and red
Like
peppers
bell
have some,
peppers.
and
They're
green
orange.
peppers.
Yeah,
Yeah,
bell
like the
pepper.
little, yeah, bell peppers. Yeah,
Mm.
the little bell peppers. I mean, they can be normal size, but they're very popular, easy to get in packs at
Yeah.
the grocery store. And usually the packs just have the orange and yellow or the orange, red, and yellow.
Yes.
The green ones apparently don't have any zeaxanthin in it, and the red have a little bit, but the orange and the yellow have a lot. And you don't have to eat them every day, but if you eat them a couple times a week, then that's a good way to get your zeaxanthin. And then the green leafy vegetables have lutein, and I think, gosh, I just looked this up the other day. Maybe beans.
Yeah.
But the main thing is the zeaxanthin, because that's something that we don't usually get. And there have been multiple studies that show the more of these pigments that you eat, the darker this pigment will come. It doesn't have an effect on how you see, but it does affect your ability to withstand damage from blue light. And there's been a lot of attention to blue light lately.
I was just gonna say, like our screens, right?
Right. So that
That's
actually came from a study where all the attention that's come to blue light came from the realization that that pigment's there for a reason. So we knew about this pigment when I was in school. We even had a screen in one of the hallways that was set to the harmful blue light color. And whenever you look at that screen, you saw a dark spot wherever you looked.
Oh, wow.
But nobody bothered to study. I don't know why it didn't occur to me. It didn't occur to anybody I know, none of my professors. Nobody bothered to find out, why do we have a filter for that light built in? And so around 2010, somebody made glasses that had this tint in it that blocked 100% of the color that this blocks. And they're not very dark. They're just slightly kind of grayish yellow. And then they made glasses to block other colors in the spectrum.
Yes.
And then they gave these glasses to patients who had early stage macular degeneration, early stage cataracts, followed them for 3 years, and found out that the people who wore the blue blocking lenses were the only ones who had a slower progression for both diseases, and that everybody else progressed the same as they would with clear glasses. So that is what started the attention to blue light. Now, so blue blocking glasses means something else now than it did when we were kids. So back in the 80s, you were a kid in the 90s, but when I was a kid, there were glasses called Varnays that were really popular, and they were yellow, and those were blue blockers. And blue blockers always meant yellow lenses, like sunglass dark yellow lenses.
Yep, I remember that.
Now what they mean is glasses that just block a little bit of blue light, and they're fairly clear, and they are helpful for protecting your retinal health and your long-term exposure to light that eventually creates cataracts. Because something that's been a mystery until this discovery was why the average age for cataract surgery has been going down. When I started practicing in 2000, I would almost never see cataracts in anybody under 75 years old. And a lot of people would make it to their 80s before they had cataract surgery.
Yeah,
now,
that's true.
People are getting cataracts in their 50s. Not a lot, but some. And it's not, I'll see at least 1 or 2 a month. New cataracts in people in their 50s, a lot of it in people in their 60s. So, like a huge reduction in the average age for cataracts.
Wow.
But, so, the question is why, right? And so we've always known that ultraviolet light caused cataracts.
Right.
So, since the 60s. But the first thing that they did was prove that we have less ultraviolet light exposure than we did, before the 2000s. And we do, because, the ozone layer has been largely restored. We don't spend as much time outside. There's much more awareness of sunglasses and caps. And all car windshields block 100% of UV light, even if they're not tinted. And so and even clear glasses will block at least 80% of ultraviolet light.
Oh, wow. Okay.
A lot of them have ultraviolet coatings, so they block 100%, even if they're clear. So we are getting way less exposure to ultraviolet light, yet people are still
More
getting
cataracts, right?
So that's where the blue blocking comes in, blue blocking lenses and screen time.
Yes, that was my question for you.
And so the amount of light that enters your eye, I'm trying to explain this in a clear way. If I'm getting 1,000 photons in my eyes from a screen that's 6 feet away, if I bring that screen 3 feet away, so if I cut the distance in half, I'm going to have 4 times the amount of light entering my eye. So instead of 1,000 photons, I'm getting 4,000 photons. And then if I cut that to 1.5 feet, it's going to be 16,000. So whenever you have the distance, you quadruple the amount of
ratio.
Light. And essentially, the phone screens are about as bright as TVs. iPad screens and computer screens are about as bright as TVs, but we're holding them so much more closely. So we're getting a lot, and we're staring at them, and so we're getting a lot more blue light in our eyes, and just light, period. The other thing regarding blue light is it turns out that our circadian rhythm is set by the presence of blue light. So
Mm.
if you think back to caveman days,
That's why they say
when
turn the
the
screen.
sky's blue, right?
Yeah.
So the sky's blue.
Yes.
When it starts to get night,
So
we had other types of light. That's fire, but fire is just red and orange. There's no blue in fire. And so when blue light starts
no,
to get reduced in our eye, then we start to get more tired. But if we're still looking at screens, even a screen,
you stay.
a white screen has blue light in it.
Yeah.
It makes us, it interrupts that ability to set
Yeah.
the circadian rhythm, which is why a lot of Apple products have the blue blocking feature. They call it night shift. And so you can set a time, you get into your settings and you click
Good to know.
plays, and then you can set a time where it will lower the amount of blue light that the screen is sending off, and you can slide it, decide how much. You can go all the way to 0.
Interesting.
That's primarily designed to help people continue to use the screen and still be able to go to sleep on time. That's why they made it.
Yeah,
But
makes sense. I'm
they're
gonna have to add
studying.
that feature on my settings or change my settings. I didn't know
Yeah,
that the iPhone had that feature.
yeah. So does
For
the iPhones and
just
iPads. Maybe the
that's good to
computers
know.
too. Yeah.
So then do you think that like if you are, I mean, we're all on our screens, like it's kind of like, the pandemic. We can't get away from it at this point. So do you think we should all be wearing those blue light glasses pretty much?
Probably yes.
Yeah.
Yeah,
Okay.
I mean, and they're easy to get. I mean, you can buy them all over the place. You don't have to. They don't have to have prescription. But if you need
Right.
prescription lenses, then
And they're so
then you can
expensive.
get that as an option when you get prescription glasses to get blue blockers. Yeah.
Okay. Yeah, yeah. Okay, that's what I was thinking too. So, and actually, one thing that I kind of deal with screen time and eye strain is the posture, right? Because the
Yeah.
longer we're sitting at our screens,
Mm-hmm.
the more fatigue our eyes feel because we're not taking breaks on a regular basis, and then you start to like shift your cervical muscles, your
Yeah.
neck forward, and then you have that hump in the back of the neck. Like we're all in this like
Right.
text neck.
No, people
So
get headaches at the back of their of their skull because they're doing that. Yeah.
exactly. And I think that you and I actually share a lot of patients because they have eye issues as well as neck and back issues because like I said, it's
Right.
it's inevitable.
Yeah.
So
Whenever I go
is
to
there
your
any
office, I
advice
see
you
people I
give?
know that are patients.
Yes,
Yeah.
me too. All the time. So do you recommend, like I always recommend to my patients, set a timer, 30 to 40 minutes, just take a second, stand up, stretch back, get your shoulders back, take a minute to step away from your screen, take a sip of water, hydrate, and get back into it.
Yeah.
Are there any other tips that you think might help people with because we can't, like I said, it's only going to grow, it seems, our screen time.
Right. I mean, it's certainly um, that helps with the eyes too. Because when we talk about taking a break, we don't mean just stop doing the boring thing that you're doing and go look at your phone and watch something interesting.
Exactly.
That's not a break. A break is looking something ideally 20 feet away, but if you're in a room, you can't do that. So at least 10 feet away so that you are, relaxing this muscle that you've been squeezing all day while you've been looking at a screen. And
Mhm.
when people look at screens, they don't blink as often.
So
So
true.
instead of blinking, every 5 seconds or so, and there's a large variability in how often, people blink, you're going to blink every 8, 10, or even 15 seconds. And so when you're not blinking as often, then the tears evaporate. And ideally, if you have healthy tear, if you produce a healthy tear film, it's not going to evaporate in the interim between your blinks. And so, we can measure what we call tear breakup time, clinically in the office. And we want that tear breakup time to be at least 10 seconds, meaning you should be able to hold your eyes open for 10 seconds before they feel dry, before you can, before the tears start to evaporate. Now, and by the time they feel dry, they've actually been evaporating for at least a couple seconds. But
Okay.
if they don't last at least 10 seconds, then there's a good chance that they're evaporating in between blinks. And so then your eyes get drier and drier, and then it starts to bug you. And then people feel, they blink like that, they squeeze. And, it's another thing you can use is artificial tears. And there's a
Yeah.
million products on the market, and, some are definitely better than others. I recommend ones that have an oil supplement in them, something that says, there's one that actually says it has omega, fish oil in it. That's a
Mhm.
good one. But any product that either has hyaluronic acid in it,
That's a
or
big word right now for anti-aging.
right,
Hyaluronic. Yeah.
and it holds the water to the surface of the eye,
Gotcha.
or something that has some kind of oil supplement, and it'll usually
So,
say, they're supplementing oil, because our tears are not just water.
right.
So there's salt water, which is about 80% of the tear volume, but then oil from our eyelids is 20%. And so right along what we call the water line, there are little pores.
Uh-huh.
So above the lashes on the lower lid and below the lashes on the upper lid. But there's 20 to 25 pores, because we have oil glands that run the length of our eyelids. And when
Mm.
we blink, then we squeeze the lid a little bit and squeeze those glands, and then oil gets spread over the eye on top of the water part. So it's kind of like if you look at it, oil and vinegar salad, the vinegar's on the bottom and the oil's on the top. If you don't have enough of the oil, then the tears are going to evaporate much more quickly. And it's really the leading cause of dry eye. And gosh, I was going to say something else about that. I can't think of it right now, but I'm sure I will.
Dr. Kamena,
But yeah,
sometimes I've used castor oil.
yeah. So there's
Eyes
been a
and-
lot of anecdotal stuff about castor oil, and it can't hurt.
Okay.
Um, and they're doing studies on health benefits of castor oil. There've been a lot of claims made. I've seen very popular YouTubers say things like they help break up cataracts. That might be true.
Wow.
It's being studied. We don't know. I can't say it's not true.
Right.
I don't know if it's true. I just don't know. But oils like castor oil, are able to penetrate the surface and get through the cell membranes and
Mhm.
get into the eye. There also helps, again, coat the eye, allow the lid to slide smoothly over the eyeball and keep the tear film from evaporating. I'm not recommending it, but I'm
Right.
not telling people not to do it, because it is not harmful to the eye.
I'm thinking the perfect combination might be the
But
castor oil with the hyaluronic acid.
sure,
Com I mean,
coconut
I'm
oil.
brainstorming here.
Coconut oil is another one a lot of people use. And coconut oil actually has been shown to be healthy for the eye.
And
And you
the
can
body.
put it in, it
Yeah.
helps. Yeah. So that's another one.
So, Doc, I know that you always have such great advice. You've always given me great advice. My eyes have come to you about so many of the things that you spoke about today, from my mid 40s, feeling like I might need glasses, and you shooed me away a little bit, to even recommending that I do some of those proper drops to hydrate my eyes better, because I am using screens so often. Like I said, so many of our listeners are probably
Yeah.
doing so. Is there one health hack, one tip that you can offer us here to, take better care of our eyes or to help our eye health
Yeah, I mean,
further?
besides the obvious thing, which is, if you don't have any kind of eye symptoms or issues, you should still get your eyes checked every other year.
Okay.
Um, and then
24 months. 24 months if you're not having
if you
symptoms.
do, usually, yeah, and if you do have some kind of identified eye issue, most people get their eyes checked every year, anyway.
Yeah.
Um, but something that I think is really, really valuable is to do eyelid massages. And
Mm.
so, so dry eye starts to kick in our 40s. We do see it younger. Oh, and that reminds me of what I was trying to say about the waterline. So don't put makeup on the waterline. Okay.
Ooh,
So a lot of women will put eyeliner right on the waterline,
yes.
and then they
Myself.
are blocking those. Now, so because I look at people's eyes under a microscope every day. I see all my patients under a microscope, and this is, my iPad's on the stand for that microscope. I see what people do, and I see, common makeup patterns. It's super common for teenage girls in their 20s, to put makeup on the waterline, but it becomes less common as women get older. I see it less and less, and it's usually not because I told them not to do it. Somehow they're figuring out that it's not comfortable, and they're stopping.
Instinctively. Not
And it
this
doesn't,
45-year-old. I still put eyeliner on my waterline. I'm not going to do that to
in
myself.
reality, the waterline is almost as wide as your eye anyway. And so if you go below the lower lashes and above the upper lashes, it doesn't really change the way you look.
I
A
know,
lot
but
of
it
women
smudges
are afraid.
down. Okay, yes, I know. I understand, Dr. Kamena. You are
So,
correct. This is
but
why I
that
need this.
wasn't the hack I was going to.
No, I know. Let's go back to
Okay.
your hack about
But,
massage. You
but,
were talking about
so,
eyelid massage.
so it's basically just, you look up like I'm doing
Okay.
now, and you press on your eyelid. So you're basically pushing on your eye. Don't
So,
push so hard that it hurts, and make sure you can feel the eyelashes with your fingers. So then you're getting all the way to the edge. And what you're doing is you're pressing on those glands and helping to express them. And then you look down, and
okay.
then what I'm doing, I like to just use the pads of my fingers, and I just kind of press straight in like this.
So you're pressing on the
And
eyelids, on the bottom and the tops of the lids, kind of like in
yes,
the corners.
not
For
just in
those
the
who
corner,
are just
all
listening.
along. I mean, I guess I'll get closer to the,
Yeah, I know. I'm just repeating, Dr. Kamina,
oh,
because some
got
of
it.
the listeners are just listening and not able to
Yeah.
see.
Oh,
So
I
really,
see.
you start off by like putting your eyes up and then using the pad of
Yes.
your finger gently to pad that lower part, like kind of the under eye,
Yeah.
and
So
then you're going
I'm
to down.
kind of
Yep.
placing, right. I'm looking up. I'm sticking my index fingers on the tips of my index fingers at the base of my eyelashes on my lower lid, and
Okay.
then I'm just kind of pressing as hard as does not hurt. If it hurts, that's too hard.
Correct.
And you only have to do it for a few seconds, and then just kind of going across. And then I look down, and I do the same thing on the upper lids.
Or where the eyelashes are. Actually,
Where, yeah, right, yeah.
it feels good to do it.
And it does. And you can actually you can start higher and then kind of go down. And you only have to spend like 30 seconds, if that, even doing it.
Easy.
But if you do it once a day, you will push all the old thick oil that's kind of getting junked up in there out, and you keep it moving. And if you do it right, you should feel it. Like, I can feel the oil in my eyes now.
I actually do. I actually feel like there's a little bit of rejuvenation too to my
Yeah,
eyes. So I'm thinking, Doc, maybe the hack, take it a step further. When you take your break from your screen,
yeah, you
instead of
could do.
looking at another screen, actually give yourself a little bit of an eye massage.
Yeah, if you do that, yes.
You could
Yeah,
get yourself
and so you don't have to do it a whole, you don't have to do it tons, but
right.
if your eyes feel dry, that can be a cue to go ahead and do it.
That's such a great tip. I'm so glad that you shared that.
Yeah,
I'm all about massage, anyways. Obviously, chiropractic massage, body work, right? Moving
right.
things around. So that makes so much sense.
You can make it part of an adjustment.
Exactly. Maybe that
Yes.
will next time you come in, I'll work
Yeah.
on your eyes as well as everything else, right? Like
Yeah.
that would be fun for me too. So, well, this has been so great, Dr. Kamena. I just want to thank you so much. I think that we'll obviously have your information, Murrieta Optometry, so that if anyone does need to seek more eye care, you obviously are the expert that I trust.
Thank
And
you.
really appreciate all the health information. You really like open my mind about the cataracts and the blue light glasses and how it all connects. And yeah, we're all going to need glasses eventually. So let's try to prolong it by doing some of these health tips a little bit if we can. So thank you so much again.
Sure.
And
My pleasure.
thank you to our listeners. It is always a delight. And we appreciate you listening. And hopefully you got something out of this to make your life and your health even better.
Thank you.
Thank you for tuning in to the Hawks Health Hacks podcast. We hope today's discussion has provided valuable insights into achieving and maintaining your health. Remember, your well-being is our priority. Visit us at hawkchiropractic.com or call 925-960-1960 to learn more or schedule an appointment.